इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. Did you know that 6% of all brain tumors occur in children, and that it is the 8th most common cancer which is found in the age of 40 plus population? Well, how do we understand this and how do we protect our loved ones? What are the signs, symptoms and treatment options available for brain tumors? We are bringing you Apollo's expert neurosurgeon, Dr. Binod Kumar Singhania, today in Apollo 24/7's Health Hour. And in this live session, you can ask all your questions about brain tumors. Join us today, 11 a.m.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. This is a show where we bring you Apollo's expert every Sunday onto this live show where you can ask questions and queries that you've been are wanting to ask and you are postponing that visit to a doctor, and here we are bringing you an expert. Today we are going to talk about brain tumors, the benign and the malignant brain tumors. We're bringing you a very senior consultant neurosurgeon from Apollo Multispecialty Hospitals, Kolkata, Dr. Binod Kumar Singhania. He'll be joining us in the live shortly. I request you all to ask your questions, get that answer from our expert. You must be watching this on multiple platforms, on Facebook, on other platforms, but I request you, if you want to ask a question, to ask only on YouTube chat, where I'll be able to ask you a question. So please do type your question, and while you're typing your question, make sure that you're adding your age, gender, your problem, and then the question that you're asking clearly into one question itself, rather than splitting your question into multiple parts. Thank you for understanding, and please go ahead, type your questions right now. I shall take them very shortly. And also on this show, you will be able to win gift vouchers, and also we are going to ask you certain questions, health quiz coming up, where you can win prizes from Apollo 24/7 as well. Please be with us to the end of the show. All right, let's start the show today by talking about this wonderful initiative, which is led by Apollo Foundation and executed by Apollo 24/7. This initiative is Saving a Child's Health Initiative. SACHI in short, we are calling this. SACHI is free pediatric consultations for every child in need in association with Apollo 24/7. SACHI is on a mission to make quality healthcare accessible to underprivileged children at no cost. Yes, you have heard it right. This program benefits children across India. More than 10 plus pediatric specialties who are renowned Apollo pediatricians are participating in this program. So go ahead, if you know a child who requires free pediatric consult, share this interesting initiative with them. Scan the QR code to know more, which is on the screen. Right. It's now time to invite our expert, Apollo expert, to the show. Today we are having a very senior consultant neurosurgeon from Apollo Multispecialty Hospitals, Kolkata, Dr. Binod Kumar Singhania. He is more than 28. He has more than 28 years of experience, and he has his neurosurgery fellowship from Louisiana Medical Center, New Orleans, USA, and spine fellowship from Royal Adelaide Hospital, Adelaide, Australia. He is a teacher and examiner for DNB neurosurgery. He has published various national and international journals. So it's a great honor and pleasure. We have Dr. Binod Kumar Singhania on screen. Namaskar, sir. Welcome to the show.
Yeah, thank you very much for the introduction.
So, sir, I know it's a Sunday, and you being very busy, you have this one day, but you have given us this valuable time. We appreciate that here. Thank you.
Yes.
Yes.
Yeah.
World Brain Tumor Day. We are celebrating this on 8th. Coming up is the World Brain Tumor Day. So we thought we should talk about this and spread more awareness about how to identify brain tumors. So, doctor, let me start by asking, the word brain tumor itself gives you a scare. डरा देता है, the entire shake करके छोड़ता है. How dangerous is this? Is this life-threatening?
See, this is the common concept of the people. The moment we are listening the brain tumor, that means it's like a killing disease. But it's not correct. Not all brain tumors are the killers. There are two types of brain tumors. One is the benign, what we are talking today, and as well as the malignant. Benign means non-cancerous and malignant means cancerous tumors. So benign tumors are well treatable. If it's in the accessible area, we can do the proper treatment. We can excise it completely. The patient is cured. But yes, there are some inaccessible area. If the tumor is inaccessible area and we cannot excise it completely, then probably it gives some morbidity and mortality as well.
Okay.
But otherwise it's a treatable disease. And even if we are treating it's incomplete, then we have other modality of treatment, like we can give the radiations for the residual tumor. And the other is the malignant lesion. Yes, malignant lesion is not very good. It's prognostically very poor, especially the brain lesions. So those who have a malignant lesion, they need a treatment like a surgery, then radiations and chemotherapy. But overall prognostic value as well as the expectancy of life is not very good. but the common concept of all brain tumors are bad is not correct. There are
Correct. So
various
let's
tumors.
understand. Sorry, doctor, please continue.
Yes, yeah. So we can treat the benign tumors, and the people are cured with all these things.
Great. So, with that positivity, let me understand what could be the signs and symptoms of brain tumors, and can this affect after certain age, or can it affect any age? How about children who are born with certain difficulties? Are they can these be congenital?
Congenital brain tumors, yes, there are certain syndromes which they are giving the tuberous sclerosis and all these things. Otherwise, the congenital brain tumors are not very common. I found some intraventricular tumors in the newborn babies, but otherwise it's not congenital. Tuberous sclerosis, it's a congenital.
Okay.
Otherwise, most of the tumors are the acquired. We are getting it in the later age, like medulloblastoma, which is very common in the child age group, but it's not a congenital lesion. And in elderly, yes, there are certain symptoms. Means there are a lot of symptoms which is coming in the other disease as well, like headache. Headache is the common features, even if you have a tension headache, if you have a migraine, and all these things. But the most important thing is the if you have a newly onset headache, you never had a headache, but now you have a headache, and especially the early morning headache. For headache, you have to wake up, or even in the sleep, you have to wake up, and then the headache is associated with nausea and vomiting, and vomiting is also a specific type. It's a projectile, means the vomiting is the forceful. So if you have a vomiting associated with headache and all these things, you need attention. The second is a memory problem. Sometimes the people, those who are doing a very high skill jobs, they have a memory problem. They have difficulty in performing the jobs. The office colleagues will tell कि now he is not doing the proper, perfectly the work. Even in the home, the family members, they will detect कि they are unable to button the shirt, or they can perform the daily regular activities. Then it needs to give the attention. And
डॉक्टर मैं ask you, सॉरी टू
yes,
these जो आपने जो सिम्टम्स बताया है, जो सर दर्द हो सकता है या वॉमिटिंग हो सकता है, या ये जो मेमोरी और अदर डिफिकल्टीज इन आइडेंटिफाइंग थिंग्स, कॉग्निटिव जो भी बोल रहे हैं, तो ये नॉर्मली अदर इश्यूज में भी दिख सकते हैं ना?
yeah.
तो बहुत ही सिंपल आम सिम्टम्स है. हाउ डू वी डिफरेंशिएट दीज?
या दैट्स व्हाई आई टोल्ड कि न्यूली ऑनसेट हेडेक मींस जो हेडेक कभी नहीं हुआ, आपको आपको लग रहा है कि ये हेडेक हो रहा है, या फिर अर्ली मॉर्निंग मॉर्निंग you have to wake up with a headache, then you have to give the attention. You should go for the investigation, and if it's normal, then it's fine. You need not to bother. So this is the thing which you have to give the attention, associated with nausea and vomiting. See, nausea and vomiting is commonest problem even for the gastritis, for abdominal problem and all these things.
करेक्ट.
But if it's repeatedly, means it's not improving with your treatment, then you have to give attention.
Okay, so are there any symptoms or any identification symptoms which have to be treated immediately, and one has to take immediate medical help?
Yeah, if you have a convulsion, then convulsion is one of the serious things. So you have to give the attention, and you have to go to your doctor, and you should know why there is a convulsion. The convulsions are, there are various causes. Means even it's without any reason there is a convulsion. If there is a brain infection, sometimes there is a neurocysticercosis, a kind of worms which is in the brain, that is also giving the convulsion. So you have to differentiate with the investigations whether it's a tumor or a neurocysticercosis, or if it's just a simple epilepsy that you need a treatment.
Okay, okay. So while these are the symptoms that one can identify, बट जैसे धीरेन्द्र नाथ चौधरी भी पूछते हैं कि व्हाट आर द सिम्टम्स ऑफ मैलिग्नेंट ब्रेन ट्यूमर.
See, there is no specific, means there is no differentiation between malignant and the benign. There is no differentiation between malignant and benign tumors because both are initially presenting with the same symptoms. Then on the imaging, you can detect whether it's a benign tumors or the malignant tumors. Yes,
Okay, it's okay.
some benign tumors who have a long durations like meningioma, then patient have a headache since a long time and then probably detected in the late stage.
Okay, so now how do we understand what are the tests that to understand this is a brain tumor once if somebody has symptoms and signs? Ismail Akhtar ji pehle पूछ रहे थे कि can brain tumors be detected by a sputum test?
No, not at all. Not at all. Is sputum is never giving any clue for brain tumor. Never.
Okay.
It can
So
give
what are
you
the
the
tests?
lungs cancers, or if it's a mouth cancer, then probably you can detect, but not the brain tumor.
So what are the tests which can pinpoint that these are brain tumors?
Yeah, see, the gold standard is the imaging, and now these days, previously there was a CT scan, or rather, if we are talking about the much earlier era when there was no investigation, then detection was very difficult. But now we have a lot of other modalities. CT scan is for the quick scanning. Means if patient has severe headache, vomiting, you just do a CT scan which can give you a clue even without contrast. There will be edema, there is a mass effect, there is some hypodensity or hyperdensity calcification. So you can just get a clue. But the best tool is the MRI. MRI with contrast because it's giving the different weighted images because it works on the magnet and the water molecules in the tumors and with the different enzymes in the tumor. So
Okay.
MRI is the best tool.
Right. So, and all of this, first and foremost, you have to consult speciality that is neurosciences
Right.
and then go forward. This is nothing like I have to take care. मैं जाके मैंने diagnostic center में मेरा करवा लिया और मैंने diagnose कर लिया ऐसा नहीं है. तो ये तो आपको
नहीं
पहले.
नहीं 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 I don't think so.
Yes.
See,
So
yesterday I had seen one patient. She has some facial twitching and all these things, and few doctors were giving some treatment, painkiller, and imaging was done, and it was found cavernous sinus meningioma. So I think don't be your doctor, and especially don't be a Google doctor. So rather you go at least a specialist for that one.
यस डॉक्टर एंड अगर कोई भी सिम्टम्स जो डॉक्टर विनोद कुमार सिंघानिया ने अभी रिटरेट किए थे अगर कोई भी ऐसे सिम्टम्स आपको दिखते हैं तो इमीडिएटली अपोलो 24/7 पे आप यू हैव स्पेक्ट्रम एंड लॉट ऑफ न्यूरो स्पेशलिटी व्हिच इज अवेलेबल ऑन अपोलो 24/7 डू कंसल्ट वन ऑफ देम एंड गो अहेड with the right treatment you will be able to get good and great treatment. Sir, one more question. Brain tumors अक्सर सर्जरी के साथ रिलेट कर लेते हैं काफी सारे लोग एंड सर्जरी स्पेशली ब्रेन का कॉम्प्लिकेट होता है सो हाउ इज द न्यूअर एज सर्जरी हैव वी प्रोग्रेस देयर
Yeah, see, I think not all tumors needed surgery, like a pituitary tumor, which is in the pituitary gland. So there are certain hormone-related tumors like prolactinoma. So if we are find that the prolactin level is high, then we can give the medicine and the tumor regress. Like growth hormones we are giving. And now there are different modalities of treatment. No need to go for a bigger craniotomy and to excise it. We have a microscopic lesion, a microscopic treatment, and along with we have a navigation system, so we can exactly localize the lesion where it is. We can do a small craniotomy. Even we have a functional navigation system. We can detect the function of that part of the brain, and we can exercise in a very small way. What we are telling, it's a minimally invasive. We have a stereotactic frame, so we can put a small burr hole, we can go inside and can take the biopsy of the lesion, or even we can excise the small lesion. And now the latest advancement is the endoscope. That is the most important thing. Even in the inaccessible area, we can approach with the endoscope, like intraventricular lesions, or even the pituitary tumors. We are operating through the nose with the endoscope, and we can excise it. What we can call it's the minimally invasive surgery.
So wonderful, doctor. I think this is the advancement of medical sciences, that we have latest technology, and Apollo has this latest technology, and
Yeah,
the
we.
senior experienced surgeons like you.
Yeah.
So it's really an interesting combination that Apollo offers. All right, doctor. Now let me start asking questions from our audience. This is a question from Mr. Agarwal, G. Agarwal. My right eye and right side of the head are paining from last 12 days. What do I need to do? So how does one identify these headaches, as we were talking earlier?
Yeah, see, if he has a problem in the eyes and headache, then I think at least he should go for a imaging, because sometimes the pituitary tumors which are giving the problem in the vision as well as eye, or sometimes the orbital tumors which is giving also the pain in the eye, or if the
Okay.
tumor is in the region of the visual fields. But it may not be. Sometimes the diabetic patient, they also have a problem. And the most important thing is the trigeminal neuralgia, means a nerve which is coming on the face. So if that nerve has compressed, then it's giving the face pain in
Okay.
the face and the eye. There are three components. So if the upper component has involved, then there is a headache as well as the pain in the eye. Like if you are remembering, the Salman Khan had a problem. He was going out of India for that treatment. It was a trigeminal neuralgia. So unless and until, and for trigeminal also, we have a imaging. We can see the trigeminal nerve, whether there is any vascular compression over the trigeminal nerve, and that is causing the pain. So I think needs a doctor consultation, and the imaging is the most important, and
Right.
obviously the
So
medication.
it is always to be good on the side where you can test and say I don't have anything, rather than missing something which is more
Yeah.
serious and treatable actually. So it's always good to go and get yourself tested, Mr. Agarwal. So next question is Mr. Sanjay Kar VP. Hello doctor, I have SCA2, a genetic disorder. I am 47-year-old male. What is an SCA2, doctor?
STA.
SC, C, C for Calcutta.
Oh.
So I'm not sure if that is
What
related to
what
you.
is the full form SCA?
अच्छा ठीक है संजय जी if you can please type what is SCA2, that will be helpful for us. Next is Shikha Jhawar's question. 40-year-old hai, 2 years back detected with a brain tumor in frontal lobe part. I am now
Okay.
on Levipil. I want to know how long do I take this, and I never feel fit and other things. Still, I have never feel fit and other things. Still, I get tumor. All MRI scans were okay for last 2 years.
No, she is telling still she has a tumor.
Yes, 40 years old, 2 years back detected with brain tumor in frontal lobe on Levipil. I want to know how long I have to take.
No, that is all right. But whether she has gone for surgery or it was excised completely, or no, it has not been
So
excised.
this is where I request all my audience to please type your questions in single part. Shikha ji, ये after brain tumor surgery इनका हो गया है. I have a lot of mood swings after brain tumor surgery. Yes, उनका हो गया है
So,
surgery.
so if surgery has been done, she received, if complete excision has been done, and she doesn't have any convulsion, then probably we can try. We are doing a easy. If the ease is normal, then gradually we are reducing the dose of the Levipil. And if she is not suffering from any convulsion, then gradually we can withdraw it. But if ease is normal or in between reducing the dose, if she has a problem with the convulsion, then we have to continue the full dose. That is the
And
at least that there should be a free from convulsion, 2 years of free from convulsion.
okay. So she's also continuing to ask, will my brain tumor pass on to my next generation, my kids?
Oh, not really, not really. Yes, certain tumors are inherent, but not really. It's most of the tumors, not really. So this should not
Done.
keep in mind. Yes.
All right. So one common question, I think this is important to take. Can the mobile phones and the radiation cause brain tumor? Annie May is asking this question.
See, yesterday only I was reading the same questions. I was seeing what are the incidents, but I found a lot of literatures they are telling no, it's not causing that electromagnetic waves. Even the microwaves we are using for warming or cooking our foods, they are emitting the electromagnetic waves, but it's not causing brain tumor. Yes, there was some reports in the second generation mobiles. That time there was a high radiation, so probably they were prone. But now these days, no, not really, not
Okay, thank
really.
you so much for that clarity, doctor. It's not just his question, it is also reassurance for all of us who use mobile phones and exposed continuously. Done. So, next question is from Mehraj Mir. Medullary 28-year-old female hai, medullary cervical tumor. Surgery is done. Biopsy is grade second. Does she need radiation?
See, probably it's an intramedullary lesions. I don't know what kind of lesion it is because it's not mentioned, whether it's a astrocytoma or ependymoma or something. So it's possible to excise complete intramedullary lesion, and if it has been excised, then probably no radiation because we resist to give radiation to the spinal cord because it's giving lot of deficits. And but yes, if there is a residual tumor, then probably we can consider. Otherwise, most of the time we are resisting to give radiation to the spinal cord.
Great. Doctor Raj is asking next question. Does anxiety or too much of emotional disorders or stress cause brain tumors?
No, not really. Not really.
Okay, doctor, thank you. Again, something that all the generation is going through, too much of stress, too much of anxiety. Next question is Rishika Terala. Hello, sir. Good morning. Have you seen any cases of spindle cell oncocytoma in India? Can you explain clearly and what's the treatment of it?
Spindle cell oncocytoma, I had not seen in my practice. I don't.
All right, doctor. So, yes, next question is Batini Santosha. I'm having numbness in left side of the head. I visited Apollo, underwent scanning. There is nothing diagnosed, but still numbness is persisting. Please advise.
See, numbness is due to the nerve problem. Means it's not really telling that there is a brain tumor because numbness because there are nerve roots are coming from the cervical region going in the head and also the trigeminal nerve. So first we have to see whether the numbness is in the trigeminal area or it's from the cervical root area, and
Okay.
accordingly we have to do the investigation and we have to treat it. I think numbness usually goes, it's not persisting unless and until there is some tumor along the nerves or something.
Okay, done. So, for any such tests or any such consultations, we've left a link in the YouTube chat box. Please go ahead, tap the link and go get yourself tested or further investigated. Next question is from Anthony Katara. My head is paining and I have vomiting. Is this any indication?
Yeah, one has to go for at least a simple investigation like CT scan and EEG. Doesn't mean ki you have any brain tumor or anything. Even the migraine is giving or the vascular headache is giving the headache and vomiting. So even the stress that can give the headache, and if you have a gastritis, then the vomiting. So stress-induced gastritis. So one can go for an investigation. I think simple CT scan and one EEG. That's it.
That's it. So, सब भूत की तरह नहीं देखना चाहिए सबको. It could
No,
be a
not
simple thing,
really.
but always elimination एक
Huh.
way to approach में
Yeah.
elimination.
Yeah. See, I have an opinion that one should spend money on the initial investigation and diagnose the things and at least get rid of your anxiety as well rather than to carry on for a longer period.
Very valid and a very experienced statement that you have given, doctor, because anxiety is the killer. So
Yes.
उसको पहले हम control में रख सकते हैं. Yes.
Yes.
Next question is from Kosha Joshi. 31-year-old है, detected with benign brain lesion, differentials low-grade glioma DNET 4 years ago, no change in size, have had 2 seizures. Is it possible that it will grow anytime down the road?
Yeah, see, sometimes low-grade glioma, we are just following it. If it's not growing, then it's all right. We are keeping on the anticonvulsant. But yes, it may grow, it may convert into the higher grade that he has to do the follow-up scan and all these things.
Done. So, how long, if one is diagnosed with such tumors, how long do they have to consult, and how long is this relationship with their neuro is going to last?
I think once it's diagnosed, then they have to go on continuously for a longer period because sometimes it's converting into a high grade, or at least he should go for a biopsy and diagnose whether it's a low grade or it's a grade 2 tumor and all. If it's
Okay.
diagnosed, then it's all right. I think.
तो ये रिश्ता एक दो दिन का नहीं है, ये नाता तो
Now,
बने रखना ही.
yeah, once diagnosed with a low grade glioma, he has to continue for a longer period follow.
G. Done. So here's Prakash Gungalia. Sorry for that misspelling. I had non-traumatic super short. I am sorry, I'm not able to read this well. SUBARCHOID. Is it
Super
making
CHO.
ID? शायद non-traumatic, any chances of relapse? That is his question. Prakash Gugalia, if you can
Just
type a proper, correct non-traumatic super
CHOID.
ID.
Super. One is the
SUBA.
colloid cyst. I don't know whether he's telling the colloid cyst or something.
Okay, ठीक है. I'll wait for him to type back and we will take other questions. So, next question is, what is central neurocytoma? विनय भाटिया जी पूछते हैं.
Yeah, central neurocytoma is also a kind of tumor, and one should go for the surgery if it's there, I think.
अच्छा. So, again, इसमें भी grading होता है या how does one decide that this is perfect for surgery and all?
Means central neurocytoma, how to treat.
Yes, doctor. Yes, doctor.
Yeah, but I think surgery is the best way, and then the biopsy. That is the.
Okay, done. So, yes, does Ruchi Jain is asking next question, doctor. Can follicular lymphoma spread to brain?
Follicular lymphoma. Yes, lymphoma is spread in the brain. Means she has a lymphoma in other part of body or
Other part of the
lymphoma is
body.
lymphoma is a common entity of brain. Means sometimes it may not spread in the brain, but we cannot exactly say because the lymphoma is a widespread lesion. It's involving all part of the bodies. So not now, maybe later on some lesion has come in the brain, but lymphoma's treatment is the very standard treatment of the chemotherapy. But if it's a brain lymphoma, then we have to go for a radiations and chemotherapy as well.
G. That's interesting, Ruchi Jain. So keep your follow up on and then continue with your investigations. Samina Ali ji पूछते हैं, I have pituitary tumor from past 10 years. I used to get headache continuously. How can I get rid of it? My doctor, I consulted a doctor and they've given Gabergolin 0.5 from past 10 years.
Yeah,
Will I
yeah.
get cured? Yeah. So will I
Yeah,
get cured or do I need surgery?
that is the thing what I was talking. If you tumors enzyme related, we can give the medicine. It's a prolactinoma basically if she's getting a capgolin. So capgolin she can continue and she needs a follow-up scan to see whether the tumor has reduced or not. So if tumor has been reduced, it's not the cause of the headache. If yes, tumor size is bigger, then the second option is she can go for the debulking of the tumor by surgery, that is the endoscopic, and then she can get the cabergoline, and it regresses the tumor. So if she has a headache, if she has a growing prolactinoma, then she should go for a surgical debulking. Sometimes
Here,
there is a pituitary apoplexy, means there is a hemorrhage inside the tumor that causes the sudden onset headache and the pituitary crisis, vision problem, then has to go for immediate surgery.
G. So next question is from Neeraj Singh, who's asking about a child. इनका बेटा 7 year old है. ब्रेन MRI अपोलो अहमदाबाद में रिपोर्ट ये दिया था कि few foci of T2WI hyper intensity in bilateral frontal subcortical white matter. So इनका क्वेश्चन है कि ये क्या हो सकता है और इनका ट्रीटमेंट क्या हो सकता है, क्योंकि बच्चे हैं शायद वो ज्यादा टेंशन ले रहे हैं.
Now, see, few foci of hyperintense foci in the bifrontal regions may be due to the ischemic changes, due to the birth insult of that one. Sometimes these childs have a birth insult and that areas has been damaged. So it's giving the different intensity in the MRI. It doesn't mean it's some brain tumor or something. Only if the child has some symptoms, some sort of fits or convulsion, then he has to continue the anticonvulsant medicine. If he doesn't have any symptoms, then nothing to be done.
Great. So, sir, how is this different in children? Brain tumor, does it present differently in children? The treatment options and all? And what's the life expectancy and the quality of life after certain surgeries?
In brain tumors in children.
Yes, exactly. Brain tumors in children, doctor.
Yeah, see, there are different types of brain tumor in children, means like medulloblastoma. So there are certain criteria, framed criteria. If we can excise the tumor completely, if it's in the younger age, then it's almost curability. If it's in the higher age, if we cannot excise it, then one has to go for radiation, and then the life expectancy is varying. It's not very good result. The other is the pilocytic astrocytoma. Sometimes it's in the children, which is like a benign tumor. So once you excise it, it has been cured. Like there is some germinomas in the children. So if you excised and can go for radiation, it is almost cured. So certain tumors it's cured, certain tumors yes not very good, like a brain stem glioma, though it's not a very high grade lesion, but brain stem glioma finally the child is not doing very well and he has to succumb in some point of time.
So, but there is an option depending on the tumor or the lesion. There are
Yes,
multiple surgical options or
yes.
chemo or radiation, multiple options.
Yeah, there is an intraventricular benign choroid plexus papilloma that once excised, it's cured. So it depends on the type of the tumor and the area of the tumor.
Ji. Doctor, next question is from Mr. Ahmed Hashmi. He had suffered from spinal tumor surgery, which was conducted, biopsy was done. It was benign and radiation therapy was also done. Then, because I was a victim of recurrence, it came in the brain and CSF was tested. It was non-cancerous. So he is asking what kind of, how does he take care of himself? He's not
No,
asking
but
me a question, so he just placed
what, I don't think what kind of benign tumor which has gone in the brain. I am not understanding
Ji.
because if a
Is it
benign, yes,
possible after getting diagnosed with spinal tumor surgery to get a, I'm the victim of recurrence and it came in brain and CSF was done, it was non-cancerous.
yeah, one is the hemangioblastoma, which is a benign tumor which is in the spine and as well as in the brain. So maybe he has a hemangioblastoma because ependymoma is also notorious. It sometimes sits in the spine as well as in the brain. So whatever the lesion, if it's in the brain, he has to go for the excision of that lesion, and if it's benign, then it's cured. And yes, if the histopathology is showing no, it's sort of some malignancy, then he has to go according to radiation and all these things.
Ji. So, Ahmed Hashmi ji, please continue to consult your neuro and then
Yeah.
take a call which is appropriate for your treatment. Then Ramya Nagraj is asking a question. 7 years ago, pituitary adenoma surgery. It grew again. Radiotherapy done 3 years ago. Replacement, Thyronorm and cortisol medicine. Any prognosis? How frequently I need to go for a checkup? Partial vision loss.
Oh. See, pituitary tumors are the notorious tumor because it's regrow.
Ah.
बे- 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 ये पंखा
So,
बंद कर. It's regrow because whatever we are excising is we are excising the tumor, but we cannot remove the capsule. So it's and she received the radiation. So I think she should go for the follow-up. Vision loss may be due to the initial pituitary tumors. Once there is a vision loss, then probably the vision may not recover. So doesn't mean कि vision loss. If she has a recent vision loss and if the tumor is increasing, then she should go for the second surgery.
okay, Ramya, so that's a very, very important suggestion for you from Dr. Binod Kumar. Please go ahead and visit your neuro. Doctor, here Sapna's question. Sapna Yadav, good morning, doctor. I want to know if dizziness is related to tumors.
Dizziness.
Yes, doctor.
No, I don't think so. Yes, dizziness is one of the symptom of brain tumor, but dizziness is a lot of causes. Even if with the ear problem, dizziness is coming. If you have a high blood sugar, if you have a high blood pressure, if your cholesterol is high, so it's a vague symptom. You cannot tell it's due to the brain tumor. So you treat your dizziness, and there are medicines to treat. You can go for the ear investigations. Just check your blood sugar, cholesterol, and pressures, and all these things. I think
Right.
that will
So,
improve most of the patients.
G. Doctor, in the initial questions, I had asked one question from Mr. Sanjay Kar VP, if you remember,
हाँ.
SCA2 के बारे में उन्होंने अभी reply किया है, cerebellar ataxia है.
Oh, it's not a spinocerebellar ataxia. Is not a brain tumor. It's a
Okay.
it's a type of symptoms where he has a ataxic gait. He has a walking problem. It's some sort of changes in the neurons and some sort of degenerative changes, you can say, or in some certain syndromes they are causing. So it's not a brain tumor. So it needs a symptomatic treatment for that one.
Okay. Doctor, I missed one important question in the beginning stages itself. Can multiple sclerosis lead to brain tumor? I'm not sure who asked this question, but I did read that question somewhere. Can
Us-
MS lead to?
Usually, multiple sclerosis it doesn't lead to brain tumor
Okay.
It's itself it's not a very good disease because initially it's responded with the steroids and all these things with, but as the time goes it's not responding, and the people
Okay.
are they are gradually crippling with this disease, but
Right. So,
usually not with the multiple sclerosis.
done, done. So Ashok Vishwakarma is asking this question. I have headache with nausea, no vomiting since last 15 days. Diagnosed migraine in 2016. I take Inderal 40 last 4 years regularly. Now doctors prescribe prednisolone 40. मुझे अभी ज़्यादा वरी होने की नीड है या एमआरआई की ज़रूरत है क्या?
No, I think at least the baseline investigation should be done. But why he had given prednisolone for the migraine, I couldn't understand because it's a
Yes, and
steroid.
also propranolol 40 will be the
Propranolol is the beta blocker, so that people are giving for the migraine. He can take it, but doesn't need prednisolone, and he has to go for a easy and at least one baseline investigation, and if it's a migraine then just continue the migraine treatment, that's all.
G. So Ashok Ji, please go ahead, get yourself tested. Um, Ram Kumar Kilada is asking next question. If edema is present, do we need to go for biopsy? कहाँ का है ये बताया नहीं है, but
Edema, what is the cause of edema? Edema is not
exactly.
a disease, edema is the
This is a
sequelae of the lesion. If there is
हाँ.
a brain tumor, if there is an infection or something, if there is a trauma in the brain, that lead to the edema. Edema is a swelling. So it's like a swelling in any part of the body. If you have a cut, if you have an injury, you have a swelling. So it's not a disease, it's a sequelae. So for
G.
edema doesn't need to treatment. Yes, if you have some disease and that causing some problem and edema is causing mass effect, then yes, you need treatment like a steroids and the anti-edema measures like mannitol and all these things. Yes.
Okay, so anyway, we're talking about edema. So let me ask Praveen's question. Praveen HV, what would be the reasons for swelling in the head?
Swelling in the head. It's a vague question. So,
It's a very vague
so
question, just like how edema was asked. So I think we'll
yes.
avoid that question, doctor. Yeah.
Yeah, I mean, swelling in the head, again, one has to go for the primary cause where why there is a swelling in the head. Hair, swelling in the skin or is swelling inside the brain, I couldn't understand. Head is a vague terminology.
G. Kitu Anvesh is asking, I had tuberculoma in 2013 and now the cyst is calcified, granuloma inactive. Will it affect male fertility?
No, not really. Not really.
So Kitu can be rest assured. Yeah.
Calcification and it's inactive means it's a dead. No, it's
So he can be assured. Next question
yeah.
is from Keshav. Hello, doctor. Is there any alternate known treatment of multicentric glioblastoma, a part of the composite treatment of excision with chemoradiation? Other than these two, what is the multicentric glioblastoma?
Glioblastoma. No,
Glioblastoma.
Leobla, Leoblastoma.
G.
See, for any
Apart from continue.
multicentric lesion, if you have a bigger lesion has been excision has been done, and chemo and radiation has been given, I think that's it. Doesn't need more treatment, and you need a follow up. That's all.
Okay, doctor. The next question is from Mr. Mehraj Mir. जी कुछ बोलना चाहते थे आप?
Thank you. Okay, it's continue.
Yeah. So Mehraj Mir का question है cervical medullary tumor grade 2 is malignant. Any therapy that they need to go through?
No, cervical. Which cervical? Is it a neck or it's a uterine cervix? That I
Cervical
couldn't. अच्छा,
medullary to
cervical medullary. So intramedullary tumors in the cervical spine. So if it's a malignant tumor, then yes, excision is the one first line of treatment, and then second is the radiation. Yes.
Okay. So after these, then are there one question, doctor, I wanted to ask. Once they're done with their brain surgery or excision or the radiation, what's the quality of life and what kind of care one has to take after these surgeries?
Yeah, see, if it's a benign tumor, it can be excised completely. I think he is completely cured, normal life. Only has to continue anticonvulsant for some time, and then gradually we can withdraw this one. If he has some partial neurodeficit due to the excision, then he has to go for the physiotherapy. Sometimes it's improved, sometimes may not improve. If it's may not improve, then he has to live that deficit. Means he has to understand and he has to live. But one can lead the normal life, whatever it is. Means there is no specific restrictions for any post surgery. Even
Okay.
in the malignant tumors, initially the peoples after excision they are doing very well. Gradually, once again it's recur, then their symptoms are coming. So it depends on the time and type of the tumor and the surgery, your
Ji.
life.
So, Achyut Gandhi's next question is, Doctor, my mother's suffering from lung cancer since 1 year and cells were passed to brain. Due to that, right leg and hand are not working. Will she be cured?
No, not really, because it's a metastatic lesion. Metastatic lesions are really it's a bad lesions because lung cancer has gone in the brain. So once there is a metastasis, if it's a solitary metastasis, then yes, either can go for surgery, or now even for solitary, we are not going for the surgery. We are giving the radio surgery, and sometimes it's controlled. But once there is a metastasis, the life expectancy is not very good. But depends on the type of the lesion and the symptoms. Sometimes some people survive for some considerable time, sometimes may not be. But
Yeah, that is really hard
once
to
you
take.
had yeah, overall metastasis is not good.
Yes, doctor. Dr. Snehal Pandey ji पूछते हैं, I'm diagnosed with Equina syndrome, CAUDA,
God
CAUDA,
icon, God icon.
Equina syndrome. There is not a severe compression on spine which justify it. My nerves are kind of degenerating. Doctor found it out in EMG test. So उनको क्या relief मिल सकता है?
EMG is not giving any clue for the cauda equina syndrome. EMG is for if there is some problem in the peripheral nerves, there is a problem in the muscles. Yes, MRI is showing there is a compression. If it's a considerable compression, then one has to go for a surgery, that is the spine surgery, and we are doing the decompression of the nerve roots, and the patients get completely relief. If it's not very bad compression, then he can just continue some medication exercises that will help him.
जी मुत्तु कुमार जी पूछ रहे हैं आई नो दिस इज नॉट रिलेटेड टू द टॉपिक दैट वी डूइंग बट समथिंग रिलेटेड टू योर एक्सपीरियंस कैन वन रिकवर फ्रॉम पैराप्लेगिया ड्यू टू स्पाइन मेटास्टेसिस
Paraplegia due to spine metastasis depends on how early it is. If it's a long duration, it has not been operated for that one, and he has a grade zero power, then there is no recovery.
ओह ओके
Especially the tumors, paraplegia with grade zero power, they are very less to improve. But
यस डॉक्टर
tuberculosis, yes, they improves, yes.
All right. Kaka, Vindhya Kakarecha is asking, my father's having two mets in the brain. We took two SRS of 24 gray and 3 monthly MRI brain. What do you think are the chances of future metastasis from lung carcinoma?
It's a very common. We cannot predict anything because there are two metastases. So probably after 2 3 months, if somebody is doing a repeat MRI, there will be a more metastatic lesion there.
Right, right. So, uh, now there are a few questions about Shruti Sinha is asking. I'm taking chemotherapy. Who had been Shruti has gone through the surgery. Then chemotherapy now. Should I take surgery? No, no. Shruti hasn't undergone a surgery. I'm taking chemotherapy. Should I undergo surgery? How much chances are there to recover? Is what she is asking. If I may remind you of Shruti's question. I don't see her question right away
No,
here.
because what kind of lesion and for what she's taking chemotherapy depends on
Yes. Uh, she has not typed it here. Age 23, how do I improve? इतना ही type किया है इन्होंने. ठीक है.
that.
I will go
She
ahead
has
with
to
other
be.
questions, doctor. I'll go ahead with other questions till Shruti types. Shaurya SJ, I have started experiencing headache on the right side of my head past Wednesday and has spread to the left side as well. Doctor has recommended Naxdom 500, but it has not helped. It has been 4 days with this bad headache. Please help.
Yeah, yeah. See, we have to treat the things first like a simple thing. Means we have to take some painkillers. She should check her blood pressure. Ki blood pressure. Sometimes there are high blood pressures. They are giving the headache. Sometimes the tension headache means they have some stress in home or the office. That has to be improved. And obviously, the painkiller is the first line of treatment. If it's not improving, then obviously we have to think about the other line of treatment.
G. So here's Shruti's question. Finally, we found it. The team has put it up here. I have a brain tumor from last 5 years. Age is 22. Treatment is being taken from Apollo Delhi, and I am taking chemotherapies. Nowadays, after taking chemotherapy, I feel really very bad. So I know
So,
chemo makes people.
what kind of brain tumor? What was the diagnosis? What was the biopsy?
Okay, Shruti, if you can type it, it'll be nice. Let me see if Shruti can type it back. Yeah, she'll take some time. Sunita Panikumar's next question I'm going to place before you, doctor. My husband got fits due to cavernoma lesion in brain. How does it grow again, or can it be cured with medicines?
Cavernomas are notorious for giving fits. So if it's accessible to excise, one can go for excision. If it's a very small lesion and if it's not excisable, then I think you can continue with the anticonvulsant. Sometimes we are giving the radiations for that cavernoma also, so that it will shrink and its size has been reduced. But cavernoma is not a cancer basically. It's a abnormal
Oh.
blood vessels. Okay.
अच्छा, इट्स नॉट कैंसरस. ठीक है. श्रुति जी ने रिप्लाई किया है, मैम कीमोथेरेपी के बाद प्रॉब्लम होती है बहुत, सांस लेने में भी प्रॉब्लम होती है. इज इट जस्ट कीमो रिलेटेड इश्यूज, और डू यू थिंक? डॉक्टर साहब ने
Yeah,
आपसे पूछा कौन सा ब्रेन ट्यूमर है. श्रुति जी, क्विकली आप टाइप करके भेज दीजिए प्लीज. या. And sir, two questions I would want to place before you are: Raj Singh says, my wife had awake craniectomy for glioblastoma, having radiation plus positive TMZ 0.12 session done. How to cope with mood swings as she refuses food and medicine?
oh, it's a post-radiation problem. So I think gradually we have to give some supportive medicine like vitamins, enzymes, and all these things, because radiation itself inducing the swelling in the brain. And if she has a problem, then we can supplement with some steroid, dexamethasone, and all these things. That will
Well,
improve
Samina
her
Ali, yeah, yeah.
mood swing as
Sorry,
well as
sorry, doctor.
increase
Sorry, I'm
the.
interrupting you.
Yeah,
Please
yeah,
continue.
yeah, yes.
I'll continue with Samni Nali's question. My pituitary tumor size is 13 by 12 into 0, TRAPACC. Should I go for surgery immediately? My prolactin level is 450 will I get any side effects? Is it related to pituitary tumor?
Yeah, if prolactin is 450, then size is considerable. It's a macroadenoma. If it's more than a centimeter, it's macroadenoma. The biggest problem with the pituitary tumor is the vision problem because it's growing just underneath the visual nerves. So once the vision has gone, it's never improved. So you have to take care of your vision. So, but prolactinoma, then she can go with the cabergoline, and probably with that one tumor has been reduced.
Done. I have two important questions, but I'm running short of time. Last minute, में इन्होंने question पूछा है. Jivaraj, sir, wife diagnosed with breast carcinoma in 2019, operated. In 21 March, secondaries formed in brain. He's not asked what is going to happen next. I'll also place you one last question before you. Chetan Sanwal, grade 2 diffuse glioma in pontomedular region. Radiation completed 2 months back. Chemotherapy, second month cycle going on. How long does it take to recover? Last two questions.
See, pontomedullary gliomas are not very good. Means there is no curability for this one. It's as long as he is doing well with this lesion, I think that's it. Because it's
So,
not a
and then the breast cancer, which has formed secondaries in brain, Jaybaraz.
Again, it's the same. Whatever the primary cancer, and if metastasis in the brain, again, it's not a very good prognostic value, and results are bad finally.
Yeah. So that's the questions from the audience. I'll have to take leave from audience right now. So, doctor, before we take leave from you, I want you to give me those immediate symptoms that need to go and meet brain tumor के जो symptoms है वो जो immediate action call करते हैं. Please give me top tips there.
Yeah, see, the most important, yes, headache, vomiting, and all these things are the common symptom. One has to give the attention. But if he has a new onset convulsion, means fits, and the second most important thing is if he has some weakness of the limbs, whether there is some left side weakness or right side weakness, or if he has some speech problem, and he has some disorientation, and he is just deviating from his normal work skill, then one has to give proper attention and should go to the doctor and should be investigated what is the cause. I mean, these all gives with the stroke also, with the brain hemorrhage, with the infarct, with the infection also. But yes, brain tumor is one of the notorious things which is, and with the advancing age, one has to be very careful and should go and take the opinion and exclude the disease and then treat it accordingly. This is the take home message.
Thank you, doctor. Thank you so much for this wonderful time and great explanation and very patient explanation. Thank you so much, doctor, for this time.
Thank you for hosting. It's a very good hosting. Yes.
Thank you, sir. Thank you, sir.
Okay.
So that is Dr. Binod Kumar Singhania taking leave from us. And I'm going to continue with the questions, health quiz questions coming up. Please answer these questions over YouTube chat. Winner's name will be announced towards the end of the show with the discretion. Winners will be selected at the discretion of Apollo 24/7. Winners, please mail your contact details at marketing@apollo247.com and gift vouchers will be shared with you. 3 questions for this week are question number 1 on your screen. Name at least 2 treatments. Name at least 2 treatment options for brain tumors. Question number 2. Which tests are done to confirm a brain tumor? Question number 2, I repeat. Which tests are done to confirm a brain tumor? Question number 1. Name at least 2 treatment options for brain tumors. Question number 3. Who should we consult on Apollo 24/7's health app for 24/7 health app for constant headaches? Who should we consult on Apollo 24/7 for constant headaches? These are the questions for today. Go ahead, type your answers in the YouTube chat only. I repeat, the answers which are typed in YouTube chat only will be considered and the winner will be picked up by Apollo 24/7 team at their sole discretion. So in the meanwhile, while we are waiting for your answers and while we select the winners, let me give away the coupons which we Here you can use them on Apollo 24/7, the app. The first one that we are giving off today is First VC. Use this code FIRST First VC, where you get 150 rupees off on first online consultation direct from Apollo. You get an expert consultation and get 150 rupees off on first online consultation. Download Apollo 24/7 app to use these. And the next coupon that we are giving away today is the code FIRST3, FIRST numeral 3. Use this on Apollo 24/7 app to get 25% off on online medicine orders direct from Apollo. Order medicines and you get 25% off on online medicine orders. These two can be used on Apollo 24/7 app. Download it right away and use. And here's exclusively for Health Hour viewers, we're giving you exclusive code. This is HH247. You get up to 199 off on online consultations with Apollo doctors and up to 20% off on medicine orders. You can use this code on Apollo 24/7 app, and this is exclusive for Health Hour viewers. Thank you all of you for joining in this session. I know brain tumor questions are quite solid questions. I know anxiety hota hai and it's not easy to type in all the details and data, but whatever best that we could put in before doctor, we could, in this very short span, we tried and get you all the answers possible. I'm looking forward for all your answers right now. CT scan, MRI, pituitary tumor, neurologist. All right. Thank you, Ismail Akhtarji. I will take note. I'll try and do my best next level. ये थोड़े शब्द कठिन होते हैं. I will try and keep up to your expectations. Right. Parvati Pillai, Devika Mondal, Samina Ali, you're the winners for today. I repeat, Parvati Pillai, Devika Mondal and Samina Ali. Congratulations. Please write back to us and claim your gift vouchers. Thank you all for joining us today. And next week, we are talking about an interesting subject, seasonal skin allergies, A to Z, whatever that you want to ask about seasonal skin allergies. Tune in to Apollo's expert dermatologist will join us. So go ahead and subscribe Apollo 24/7. This is 11 a.m. next Sunday, 12th June. And we're going to take in all your questions there. Thank you again for joining us this Sunday. Thank you so much. Please do take care of us. Take care of your health.